Agenda item number 15, 2021-107, the Department of Developmental Services, oversight of regional centers. Assemblymember Frazier, please proceed when you're ready.
So thank you, Mr. Chair and Vice Chair and members of the committee, and I also want to acknowledge your hardworking staff, Mr. Chair and Vice Chair. Through my work as Chair of the Assembly Select Committee on Intellectual and Developmental Disabilities, I've heard from Californians around the state about various areas of concern involving the Department of Developmental Service and the regional centers. To date, I've held 8 Select Committee hearings across the state: San Diego, Coachella, Fresno, Concord, Eureka, Sacramento, Riverside, and Redding. Additionally, I've made an online survey available on the Select Committee's website with a primary goal of assessing client and caregiver parent experiences with providers as well as regional centers. Nearly 600 consumers have completed the Select Committee's online survey describing their interactions with DDS and the regional centers. I have found that there are not enough service providers at the regional centers to handle existing caseloads and repeated problems of full transparency between service coordinators and the consumers on available services and that are provided, just to name a few. I want to share with you one individual that I had an occurrence with who came to me. Single mom with a severely autistic young boy who was told by a service coordinator that they could not have services provided because she made too much money. She was denied services for 5 years because of that service coordinator had no knowledge of the system and didn't know what they were doing, basically. But yet that young boy lost 5 years of his life of help. That mother could not take a shower in the morning for fear that the boy would damage himself or the house. Could not drive to school without being pummeled by that young boy. At risk of other drivers too, because that service coordinator wasn't trained well. And again, I'm not trying to disparage that service coordinator, but there is a desperate need to have a look at how we're delivering services to this community. The regional centers were developed and started in 1971. We have 21 regional centers in California. Over 350,000 individuals have IDD in California. And if you just do the math and you do an equation, it's over 16,000 individuals per regional center. We know there's a desperate need for service providers. We've said that. Also, a desperate need for employees of those service providers to provide the direct support to the consumer. What I'm asking for, and through my role in the last 9.5 years as being a chair in different committees, I've had exceptional opportunities with the state auditor in my role of oversight to be able to perform my job. When I know that we can have this opportunity, and this is not to disparage regional centers or DDS, we have to be able to provide how we are providing to the consumer, from the consumer back to the regional centers. How can we do it better? What are we missing? What are we doing right? But that's never been done since 1971. And I would love for us all to combine our efforts to, we just did historic funding for the IDD population in this budget. Historic. But you know what, ladies and gentlemen? That brought us up to where we should be as of 3 years ago. That's when the rate study was actually completed. This will also give us what kind of value we can get for our money going forward. And looking at the quality outcomes, which are in this budget, metrics of outcomes and performance, which God love our director in DDS, Nancy Bargeman. She is absolutely a godsend for this community. But she's one person. And there's 350,000 individuals that we do need to make sure, as our role, as the guardians for this population, that they are being served correctly and appropriately. And I do have 2 expert witnesses, Mr. Chair.
Thank you, Mr. Frazier. We'll go ahead and move to your witnesses. I believe we have Tracy Butler, the program coordinator for Vistability, and Debbie Davis, owner and director of Special Care Services. And I believe they're on the phone lines with us. If we can move to the phone lines. Madam Operator?
Their lines are open.
Please proceed.
Good afternoon. This is Debbie Davis, and I am a registered nurse and a small provider of services for children and adults with developmental disabilities who are also medically fragile in their homes. I'm also speaking as a family member of a regional center consumer with complex needs. I support this audit, and I think it is crucial to identify areas where there's gaps and barriers in the system, as well as disparities in accessing the system and disparities by regional center and geography. Should be really inclusive of consumers and families, and I really appreciate that that is part of the scope of this audit objective, is to include them on their own individual feedback on the services and service gaps. What did they need that they didn't get due to either lack of authorization or lack of providers in certain service areas? And I think along with this audit, there's three really important factors to consider in planning, especially with the timing. COVID-19 has hugely affected the entire DD system for the past year and a half. And at this point, we're still far from normal, just dealing with all of the fallout of that. So I would recommend that if the audit is done fairly soon, that it include things with COVID-19, what went well, what didn't go well, where were the challenges, what could we do better in a similar situation to improve. We also lost lots of employees to unemployment and just, starting to recover now, but it's going to take time. Also, number two, the audit would evaluate a system that Assemblymember Frazier just mentioned that by its own report and rate study was already $1.4 billion underfunded. So the recently authorized 1.2 rolled into 5 years would get us to 2019 funding levels as of 2027. A good start, but we need to do more in this area. And then as the description outlines, thank you.
Thank you. If we could move to Ms. Butler, please.
Hello, my name is Tracy Butler, and I am also an advocate and a vendor of the Regional Center, as well as a family member. I want to definitely support an audit of the system. I think that we've been lacking for many years on looking at where our problems are instead of dealing with them. We just overlook. I do believe that we need to start with the individual and follow them, and not start with the Regional Center or the Department of Developmental Services. We need to look at the individuals and find out where they're lacking and where they're missing their services. I'm like I said, I'm a family member of an individual, and she came to live with me, and I became her care provider. I've been a vendor for 20 years. I had a hard time navigating the system. I was shocked to find out all the things that she was that were available to her were not ever offered in meetings. So I had to bring these things up, and then we're told, sure, you can have these things. So I think that there is something there. I'm not sure if it's just that case management feel partial to some vendors versus other vendors. So I do think that that needs to be looked at. The funding is always going to be a problem for us. We're very grateful that Jim was able to help us get that $1.2 billion, but like Sydney said, it's just the start. I really do hope that this audit helps look into what's really going on with the Department of Developmental Services. Today was a devastating day for us.
Thank you. Thank you for your testimony. At this time, let's go ahead and move to the State Auditor's presentation. Madam Auditor, please.
Thank you, Mr. Chairman and members. As Assemblymember Frazier indicated, this would be an audit of both the Department of Developmental Services and certainly going to a selection of regional centers and looking at a variety of issues really around the accessibility to services, the quality of those services, the timeliness of those services. But I'll at a high level go through the key objectives. Again, looking at DDS and their oversight responsibilities, what caseload ratios have they established? How do they make sure that the regional centers are complying with those particular ratios? And then with respect to services, whether or not DDS is providing training to regional centers to include steps to assess quality of services for consumers, timeliness of those services, and then the efforts DDS and the regional centers make to educate parents and legal guardians of individuals who are receiving services through the regional center with service providers via the regional center. Whether or not DDS and a selection of regional centers actually monitors vendors to ensure that those services are adequate, that they're cost effective, and that they meet the requirements of the consumer, the needs of the consumer. In addition, at the regional centers, the members asking us to select some individual program plans for some consumers to assess whether or not the goals established in that IPP were actually met. Has there been follow-up to determine whether the consumers are getting quality services? If certain services are not available within that region, what efforts does the regional center take to try to seek those services elsewhere to provide those services to that consumer? Asking us to look at the board of directors. What responsibilities do the board of directors at the various regional centers have? Do those responsibilities, are they duplicative of DDS responsibilities, but certainly looking at what the boards of directors are doing? To the extent consumers do not have services available, evaluate the reasons why. And again, looking to determine whether or not regional centers are looking elsewhere to try to get those services for those individuals. Determine whether or not regional centers have data collection policies and procedures for customer service metrics, looking at things like how long did a consumer have to wait for access to a particular service? How convenient was that particular service? What's the quality of the service provided? So a variety of different metrics. Also asking us to look at professional qualification requirements for staff and management at both developmental services here at the state level and regional centers, specifically related to direct services that are provided, and really looking at here are the qualifications. Are we ensuring that the individuals we hire and employ meet and comply with those requirements? And then the last couple of objectives were related to if DDS determines that a service provider is negligent or is in violation of the law, what mechanism do they use to communicate that information to consumers, potentially to other regional centers, et cetera? So is that information getting out there so people are aware that this particular service provider is in violation of the law and should not be one that perhaps the state or the regional center should be continuing to engage with? And then the last objective is really looking again at some metrics. Selection of regional centers assess consistency, timeliness of intake, provision of services. If an individual or their legal guardian or parent requests a modification of those services, is that happening? How timely is that? Notification to DDS or other regional centers, as I was speaking a minute ago, about actions taken against vendors. Did a regional center or the Department of Developmental Services take an action against a vendor? How well is that being communicated to the service provider, regional center community, essentially? What information do the regional centers provide regarding how to file a complaint? Again, this would be to consumers themselves, but also to legal guardians and parents. How do they have the ability to file a complaint or dispute services or the amount of services that an individual consumer is receiving? The last two issues, do the boards of directors, are they transparent about their discussions? Are their meeting minutes posted publicly? What kinds of conversations or discussions are the boards having? And then the final area is complying with certain contracting requirements that are laid out fairly specifically in the Welfare and Institutions Code. So this audit, again, is relatively large because there are a lot of objectives, as I went over. We would go to a selection of regional centers as well as Department of Developmental Services. This one may be similar to some of the other audits where we have the team go out together, but then split the team up so that we can reduce the chronological time it would take us to conduct the audit. With that, Mr. Chairman, I'll turn it back to you. Thank you.
Thank you, Madam Auditor. Appreciate that. Let's move to the affected agencies, and I believe we have on the line with us Mr. Brian Winfield and Ms. Erica Reimer-Snell, who are with the Department of Developmental Services. Madam Operator, if we could turn to the lines, please.
Good evening, Mr. Chair and members of the committee. Can you hear me?
Yes, please proceed.
Brian Winfield, Chief Deputy Director for the Department of Developmental Services. Thank you for the opportunity to speak this evening. We appreciate the interest in oversight, accountability, and transparency in developmental services, as this is a major focus both for DDS and for regional centers. In fact, the department's reorganization in 2019 was aimed at and addressed areas of need for additional oversight and the availability of our DDS staff to our community. There's statutes, regulations, and regional center contract that provide for extensive DDS oversight of regional centers in many areas, including regional center operations, to include annual reviews of caseload ratios, administrative expenditures, personnel and executive director salaries, annual regional center independent financial audits, and biennial DDS fiscal audits, and reviews of purchase of service policies and assessment tools. In the area of regional center performance, annual outcome-based performance contracts are required by regional centers in collaboration with their local communities. We have national core indicator surveys where we review that data to assess how regional centers are meeting the needs of their local constituents, and regional centers use that data with their local communities as well. These performance contracts also look at the timeliness of intake and assessment and improvement that's needed there, as well as annual purchase of service disparities data to ensure that we're meeting the needs of our underserved communities. With regards to boards of directors, our staff attend all regional center board meetings. We also review annual board composition, and we also review conflict of interest statements by board members and follow up with boards on issues that are observed in meetings and otherwise. With regards to health and safety and services, our staff review special incident reports that are submitted by regional centers on a daily basis and follow up as needed. We follow up on consumers' rights and whistleblower complaints and review fair hearing requests and data. The request for audit isn't clear to us regarding the focus and presents itself as being broad and not targeted, which may make it difficult for DDS and regional centers to best assist and support the request without clarity. Additionally, some elements are not mandated requirements or not in alignment with statute, regulations, or contract. For example, it speaks to regional center board member compensation, whereas board members are unpaid volunteers. It speaks of board member contact information. While all boards have a way to contact the board through an email address or otherwise, we don't believe it's appropriate to have email addresses for individual members or contact information. The request asked if DDS tracks service provider organizations that are found to be negligent or in violation of law. This is not a DDS function, and no definition is given for negligent. And since service providers must comply with numerous laws, there's no focus on which laws would be pertinent to the audit. Several of the audit items would expect DDS to be involved in the individual program plan process, where decisions are made regarding the types and amounts of services that individuals receive, whereas DDS does not have the authority to be involved in those discussions. For example, services that are unavailable in a regional center catchment area, determining whether DDS took action to seek out those services and provide them to the consumer. Ensuring that vendor services are adequate and cost effective, which would be impossible for DDS to do without being part of that planning team, which is not consistent with statute. And determining whether DDS takes steps to promote the availability of services from vendors. Again, not a role that DDS takes. It's important to note, as has previously been noted this evening, that the proposed 21-22 budget builds on prior year initiatives of change and represents transformation of the developmental services system. Examples of this reform include implementation of rate models to increase provider rates, additional funding for regional center operations, prioritizing service coordinator positions, and associated development of person-centered outcomes. Each of these initiatives are anchored with a new incentive payment program, all moving us from a compliance-based system to an outcomes-based system.
If you could please wrap
If
up.
the audit moves forward, I'm sorry?
If you could please wrap up, we'd appreciate that.
Yes, if the audit moves forward, the scope would be, we recommend that the scope be refined with the focus being compliance with statute, regulations, and contract, as well as meaningful outcomes. We're happy to work with the committee and Assemblymember Frazier if a discussion would be helpful. Thank you.
Thank you, appreciate that. Was there additional testimony?
Not from DDS, thank you.
All right, thank you. With that, let's go ahead and move to public comment. Let me see if there's any public comment in the chambers. Hearing and seeing none, let's move to our remote testimony station. Do we have any public comment at our remote testimony station? Hearing and seeing none, let me turn it to the operator. Let me see if there's anyone in queue on the phones. And if, once you place yourself on queue, if you could please state your name, organization, and position on file item number 15, 2021-107, oversight of regional centers. We'd appreciate keeping your comments to just your name, organization, and position. Madam Operator, open the lines, please.
If you are in support or opposition of 2021-107, please press 1 then 0 now. And we do have a comment from line 317. Please go ahead.
Please proceed.
Oh, just be one moment here. Okay, your line is open, 317.
So, Lori Saldana speaking in strong support. This sounds like a great plan. Thank you.
Thank you. Next witness, please.
And the next witness here will be just a second. They're getting their line number. Once again, that is 1 then 0 for support or opposition of 2021-107. And the next one is from line 229. Go ahead.
Hi, this is Erica Schwartz. I'm a community member of the Antelope Valley and a mother with a child with disabilities who has waited for almost over a year to get services through Regional Center, and I strongly approve that this audit happen. I hope you guys approve it as well. Thank you.
Thank you. Next witness, please.
And Mr. Moderator, or Mr. Chairman, I'm sorry. We do not have anybody else in queue.
All right. Thank you, Madam Operator. Let me return the item back to members here in the chamber. Let me ask if there are any comments or questions. Senator Laird, please.
I want to thank Assemblymember Frazier for bringing this forward. And a lot of us worked on the budget that has just been adopted, and there's $1.2 billion more, as was referenced by one of the witnesses, and also help for self-determination plans and other things. And if you read the audit, there's some things that might be ascribed to not having enough money. So how does it mix with how you prepared the audit before we did the budget, and now that there's money in the budget for a bunch of these things, how do you think that will unfold if we were to adopt the audit the way it's requested?
Appreciate that question, which, in all honesty, when we, over the last 3 years of trying to get to this point for this audit, we never thought that we'd get the $1.2 billion. And, you know, due to the hard work of the legislature, you know, kudos to all of you for doing so. As it was mentioned by one of the witnesses, the implementation isn't complete until 2027. You're going to see over a period of time, and as you heard the one witness who hasn't got any services for a year and is still waiting, there's hundreds and thousands of people in that role. We need just an unbiased, another set of eyes. When I was a building contractor, I always appreciated the building inspector to come in because I was walking over stuff that I might not have seen, and he saved me to do a better job. This is just another opportunity for another set of eyes to say that we are doing it right, we can use improvement, or we're doing things, you know, that really do need improvement. But the people that are receiving the services really never have had a voice. And so that's what the whole crux of this is.
Let me just, on my own time, comment. I appreciate that. And I think that part of the problem, I was budget chair in this chamber from 2004 to 8, and a lot of the institutions were closed down, and at the time, 80% of the money went to 20% of the recipients in the institutions, and 20% of the money went to 80% of the recipients in the local programs. And yet, when the hospitals were closed down, the savings from the money didn't shift to the local programs. And so I think part of this is the resources and how they've been allocated, but I'm willing to go with your suggestion that we have the independent eyes, we look at it, and if part of the recommendation is money, then at least we know that that's it. If part of it is that the services could be delivered better with the existing money, then we would get at that. So despite the fact that there might be some redundancies in here, I think it's worth going ahead with.
Well, I appreciate that. And one of the things that I have to add, Senator, is the IDD population grows by 25% every decade, and there's no COLA in that. So we'll look in 5 years and we'll have a 12.5% increase in population being paid the same amount of money.
All right, thank you. Let me ask if there's additional questions or comments for members in the chamber. Hearing and seeing none. Let me ask Mr. Frazier if you'd like to close.
You know, Mr. Salas, I want to thank you for staying there with me. You stayed there and believed in me. Your staff was wonderful working. Mr. Laird, thank you for your kind consideration. This is something about humanity and about people that don't have a voice, and all we care about is that they're being treated fairly. I respectfully ask for your aye vote.
Thank you, Mr. Frazier, and I appreciate you working with the vice chair as well on focusing on when we're talking about the scope of the letter. Appreciate you doing that, and you're a strong advocate, and one of the reasons why we have $1.2 billion over the next 5 years for the DDS community, and so I want to thank you for your hard work on that as well. That has a do pass recommendation for me. Madam, do we have a motion? Moved by Senator Leyva, seconded by Assemblywoman Berner Horvath. Madam Secretary, call the roll.
The motion is to approve Audit Request 2021-107, Department of Developmental Services, Oversight of Regional Centers by Assemblymember Frazier. Assemblymember Salas.
Aye.
Salas, aye. Berner Horvath. Aye. Berner Horvath, aye. Kiley. Patterson. Rubio. Vopel. Vopel, aye. Wood. Wood, aye. Senator Laird. Laird, aye. Becker. Becker, aye. Borges. Borges, aye. Glazier. Hertzberg. Leyva. Leyva, aye. Nielsen. Nielsen, aye.
That motion carries. We'll hold the roll open for additional members. Thank you, Mr. Frazier.
Thank you, Mr. Chairman.
At this time, I'd also like to remind members that you are required to wear a mask in the building and on the chambers. Please make sure you have a mask that covers your mouth and your nose if you are in the chamber or in the building. So thank you. With that, we're going to go ahead and proceed to file item number 16. This is 2021-109, San Diego County Sheriff's Office. I see Assemblywoman Weber with us. Assemblymember, when you're ready, please.
Thank you, Mr. Chair and Vice Chair. On behalf of the Democratic members of the San Diego delegation, thank you for allowing us to present our request to authorize an audit of the San Diego County Sheriff's Office. San Diego County faces a crisis in our jail system. Local advocates and media have called attention to the dangerous conditions and large number of suicides and other deaths in San Diego County jail facilities. There is an extensive public record documenting the tragic loss of lives, systemic failures, and inadequacy of oversight. Families of those who have died have filed numerous lawsuits alleging that the county and jail staff acted with deliberate indifference to inmates' serious mental health, medical, and related needs. According to a 2018 report from Disability Rights California, from 2014 to 2016, the 17 inmate suicide deaths in San Diego County far outpaced other large California county jail systems. For example, the Orange County jail system had 1 suicide, and the Riverside and Sacramento County jail system each had 3 suicides during the same 3-year period. Even the Los Angeles County jail system, which has an inmate population more than 3 times larger than San Diego County Jail population, and a history of significant problems related to inadequate suicide prevention and treatment of people with mental health needs, had 8 suicides during this 3-year time period, less than half as many as San Diego County. In 2019, the San Diego Union Tribune investigation found that since 2009, at least 140 people have died in county custody, making San Diego County's jail mortality the highest among large counties in our state. We know that this crisis of inmates dying behind bars is not the work of any one individual. This is a systemic issue that requires an independent, objective review so that we can completely understand how a jail sentence became a de facto death sentence for members of our community. And based on the findings of this audit, implement corrective actions to prevent this from continuing to occur in the future. With me by telephone, I have 2 witnesses in support: Liberty Sanchez from the Legislative Advocate for SEIU California, and Paloma Serena, whose daughter unfortunately died in custody at the Las Colinas Detention and Reentry Facility in November of 2019. Thank you.
Thank you, Assemblywoman. With that, I believe you have testimony and support that is on the phone lines with us. On the phone lines, Madam Operator, if you could open the lines for Liberty Sanchez, who's with SEIU California, and Paloma Serna, who's a San Diego resident.
Good evening, Mr. Chair and members. Libby Sanchez on behalf of SEIU California, representing healthcare workers in the San Diego County jails, here in support of the audit request regarding the San Diego County Sheriff's Office. I'm here to tell you that the conditions in the San Diego County jails, overseen and administered by the San Diego County Sheriff's Office, are unsafe for detainees and healthcare workers alike. We are deeply concerned about the lack of adequate and appropriate staffing levels and lack of adherence to general practice protocols, such as direction of healthcare service providers by licensed medical professionals rather than law enforcement. The conditions in the San Diego County jails are not just dangerous and inhumane for the detainees, they are dangerous and inhumane for the healthcare staff. The jails are currently so short-staffed that my members are subject to mandatory overtime, which leaves them exhausted and leads to unnecessary burnout-related turnover. This is deeply personal for my members, who have dedicated their lives to the provision of health care to a population most of society chooses to ignore. My members are deeply concerned that despite their best efforts, they simply cannot provide the high-quality level of care demanded by this high-risk patient population when they are this overworked and exhausted due to inadequate staffing. We are hopeful that the committee will approve this audit request so important questions may be asked and answered regarding the unsafe conditions at the San Diego County jails. We hope that this transparency and accountability will lead to important changes at the San Diego County jails that will better ensure an adequate and appropriate healthcare delivery system and the health and safety of detainees and healthcare service providers alike. Thank you for your consideration of this request.
Thank you. Let's move to the second witness, please.
Thank you, Chair and Vice Chair of the committee. My name is Paloma Serna. In 2019, my 24-year-old daughter, Elisa Serna, died at the Las Colinas jail in San Diego. She died from dehydration after the staff ignored her for vomiting for 5 days. On Elisa's last day,